everyone, this is MBBS Gallery. Today our topic is about sinuses of pericardiums. Let us have a look on diagram first. This is a heart actually, pericardial cavity. During development of the heart, there is two tubes, the arterial tube and the venous tubes. These two tubes actually contribute to the formation of sinuses of the pericardiums. Let us have a look. This is arterial tube of pericardiums, which consists of ascending aorta and pulmonary trunk. These two are all present in arterial tube of pericardiums, and likewise there is a venous tube which contains vein compartments. So this is superior vena cava and this is inferior vena cava, and these are all the pulmonary veins. This is left pulmonary vein and this is right pulmonary. And this arterial tube and venous tube tends the formation of pericardial sinuses, and so that it forms a sinus here and the sinus here. This sinus, which is more like horizontal, so that's why it is called as a horizontal sinus, that is transverse sinus, and this is an oblique nature, so that it is oblique sinus. Let us see little more clearly. Sinuses of pericardiums. The epicardium at the root of the great vessel is arranged in the form of two tubes, as we already know, the arterial tube and the venous tube. The arterial tube encloses the ascending aorta and pulmonary trunk at the arterial end of the heart tube, and the venous tube encloses the vena cava and pulmonary veins at the venous end of the heart tubes. So that there are two sinuses of pericardium which is formed by the arterial tube and the venous tubes. That two sinuses are, one is transverse sinus and another one is oblique sinus. Let us see about transverse sinus detailedly. Transverse sinus, it is a horizontal gap between the arterial and venous end of the heart tubes. It is bounded anteriorly by the ascending aorta and pulmonary trunk. Posteriorly, it is bounded by superior vena cava, inferiorly by the left atrium. On each side, it opens into the general pericardial cavity. Another time, next, one more time. This is a transverse sinus, horizontal gap between the arterial and the venous tubes. It is, let us see the boundaries. So, it is anteriorly by the ascending aorta and the pulmonary trunk, posteriorly by the vena cava, superior vena cava, inferiorly by the left atrium, which is somewhat like here, and on each side it opens into the general pericardial cavity. This is the boundaries of transverse sinus. And development. The transverse sinus is actually developed from degeneration of central part of dorsal mesocardiums. One more time, this is we have to remember the transverse sinus, which is developed from degeneration of the central part of the dorsal mesocardiums. And next, move on to the oblique sinus. It is a narrow gap behind the heart. Just present behind the heart. Note that is a narrow gap behind the heart, and its boundaries are anterior left atrium, posterior parietal pericardium and esophagus on each side by reflection of pericardiums, and below and to the left it opens into the rest of the pericardial cavity. The oblique sinus permits pulsation of the left atrium to take place freely, and it is developed due to rearrangement of the veins at venous tubes. And the clinical significance. The clinical significance, as we come here, is pericardial effusion. Fluid may build up in the pericardial sinuses. This may be diagnosed with transesophageal echocardiography. In another one, this sinus is clinically important because passing one end of the clamp through the sinus and other end anterior to the aorta or pulmonary trunk, which allows complete blockage of the blood output. This is performed during some heart surgeries. Thank you.